So if a patient is referred to my office for an evaluation for a bone graft, the first part of the procedure is called a consultation, during which time I will evaluate the patient's concern and most likely take an x-ray. The x-ray I prefer to take in evaluation for a bone graft is called a CAT scan. It's a 3D CAT scan which is limited to the area that we're concerned about so that there's not a lot of radiation exposure. And the advantage is that it shows me the patient's jawbone in 3 dimensions, where I can really get an evaluation of how much bone they currently have and how much bone they need, which is something that's not available on a regular x-ray. After that, we evaluate the patient's medical condition to determine whether or not they have any medical issues that would be contradictory or contraindicated to performing a bone graft. And if everything is okay and we're planning to do the procedure, then we would call in some medications to the patient to have available by the time we do the surgery. And that includes an antibiotic, a narcotic pain medication, and a special medicated rinse. Then the patient would come in for the procedure. And the procedure is usually done under intravenous sedation, which is a light anesthesia where the patient is in a twilight sleep. It is not a general anesthesia, so the patient's not in a coma, but it does really help the patient relieve some of the anxiety that patients might have about being in a dental office, having surgery in their mouth. And so here you just fall asleep and you wake up when we're done. The procedure normally takes about 30 minutes. During the procedure, the area is anesthetized with a numbing medication, the gum is opened, and the bone graft material is placed as needed. It is then covered with a special covering called the membrane, which keeps the bone graft in its position so that it doesn't move during the healing process. And then the area is closed or sutured together with either dissolvable sutures or non-dissolvable sutures. If they are non-dissolvable, the patient has to return to the office to have them removed. The patient is then seen in 2 weeks to see how they're doing, to make sure all the sutures have been removed, and then following that, the patient is seen at the 4-month interval. During that time, the patient really feels nothing going on, and the bone graft is healing internally by the body replacing the bone graft with the patient's own bone. At the 4-month point, the patient is returned back to the office, another x-ray is taken to evaluate how much bone we've been able to grow, and then the patient is scheduled for the implant procedure. The immediate recovery, most patients report 2 to 3 days of mild discomfort. They might have a little bit of swelling depending on the size of the bone graft, for which they might take either a narcotic or a pain medication that's just regular over the counter. And we certainly stay in contact with the patient during the aftermath of the procedure, and the patient's always available to call us with any questions.